Okay, let's start, João.
Yes, let's get started. Okay, good morning, everybody. Good afternoon. Good night, wherever you are. Good evening. Today, we're going to start off our Gemini meeting with Dr. Thomaz visiting us here today. It's a great pleasure to have her here, and every time she comes and talks or attends, it's always a pleasure to hear her and the amazing work that she's doing. I also see some of the folks from her research group joining us today. You're very welcome. You're always welcome to join the Gemini meetings. They're an open space for our collaboration. You're all very much part of it. So Dr. Thomaz is a very good friend from many years from the Federal University of Maranhão, where she is one of the faculty in the graduate program in public health and has had many different roles over the years and is now dedicating a lot of her attention to addressing the issues in public health, maternal and child health, oral health, in using data science and different implementation science approaches, which is very aligned with the work that we do. So, Erica, please.
Hello, everybody. Thank you very much, especially to João and Catherine, for asking me to share with you some of our results and what are you doing here in Federal University of Maranhão. It's a very good pleasure, a big pleasure to stay with you today, and I will try to do my best, especially in talking in English. So today we will talk about one of our most recent research here that is related to intergenerational predictive factors and dental caries in Brazilian adolescents using a machine learning approach. Okay. So dental caries is the most frequent, the most prevalent non-communicable disease, chronic disease around the world. Every year, something like 400 million new cases of dental caries are occurring around the world. And every year, we have an increase of 15% of the cases. So this is a very big problem for public health. And in the last years, we are discovering that dental caries is not only caused by, for example, sugar consumption or not brushing the teeth. More than this is an intersectionality disease, a chronic, non-communicable, and dynamic disease caused by intergenerational conditions. So we are using machine learning and artificial intelligence to try to understand better this disease, because even with the implementation of fluoride in the waters and distribution of fluoride in the toothbrush, even with the most recent actions led and by the researchers and by the managers around the world, the problem is not continuous increasing. So in the area of artificial intelligence, we can use, for example, we can process big data and identify patterns in a very big amount of data. And also we can analyze images, and this kind of things are doing in public health and especially in oral health to try to reduce the errors for diagnosis and also for a personalized treatment with data integration. And in this case, especially specifically in our research, we are using machine learning to predict some diseases in order to support the clinical decision. So for this research, our main objective is to study the role of predictors of dental caries and tooth loss in adolescents and young adults. We are using data for our first cohort study that we started in the ages of 19s. So in this time, we collected the data for in each 7 uh, alive burn in the hospitals in São Luís City, with a total amount of more than 2,000 live burns. So we collected the data in that time and we follow up these people. And when they were 7 to 9 years old, only one sample of these people was followed up. And when they were not 18 to 19 years old, we also followed up them. We had very many problems to find these people 18 or almost 20 years after. Most of them we were not able to find most of them. We only could find 654 people that was born in 1997. So we opened our cohort and we included 1,861 people that were born in the same year, but that were not studied in that time. So our final amount was this. But for this research, we used only the people that were assessed in the baseline, in the second moment, and in the third moment. And we used many different kinds of inputs. Even when the baby was already in the mother when the mother was pregnant or even before this, because we are studying the intergenerational predictors. So things related to the socioeconomic conditions and early care and behaviors and stressful events and comorbidities, and also access to health services, care, and oral health conditions for the mother, the father, and the child and the adolescent. And we are investigating the predictive possibilities of these inputs for dental caries and tooth loss. Talking about some of our methods, for the predictive analysis, we followed the steps according to Lu et al. That asked us to linkage the data to pre-processing and making the descriptive analysis. And we trained and test use our algorithms using different machine learning models. We use more than 12 different algorithms, and we did the cross validation, and we would like to make the external validation, but this was not possible. This was one of our main limitation. We realized that in Ribeirão Preto, where you did some similar researches than here in São Luís, we didn't have the same information, so we couldn't make the external validation with the same population. And we are trying now to make the external validation with data to another court made in São Luís, but this step was not done yet. So the last step was to build a risk calculator app. And when some of our results for the first outcome, dental caries, until now, our best algorithm was SVM radial, and with this we achieved an area under the curve around 65%. And for us, the main how can I say, what is most important for us is the sensibility, because we want to be able to find people using data from the childbirth and data from 7 and 8 years age to predict what will occur in when they will be 18 or 19 years old. And even if we make some false positive cases, this is not a problem because the intervention is very good. That is to stay with these people more close, to follow these people with actions related to behavior and reducing comorbidities and things like that. So the sensibility is the most important thing for us at this moment. And with this algorithm, we could find a little more than 70% of the sensibility. And our main predictors were the previous experience in the deciduous teeth, because now what we are predicting is dental caries in the permanent teething. And we use the data for the deciduous, the temporary teething. So the previous experience with caries was the most important predictor. And besides, conditions for the house of the people, things like having water and garbage collection and things like that. And also previous experience with, how can I say, dor de dente, tooth headache.
Toothache.
Yes. So the how big the child is, because we believe that this is a proxy for desnutrition. And also the income, the family income, and the exposure to tobacco and other things. And for the other outcome, that is tooth loss, the better algorithm was at a boost with an area under the curve above 60%, and the sensibility of this model was also around 71%. That this was our, with many tentatives, this was our better result. And the main inputs were also related to the tabagism, passive tabagism, and not having breastfeeding, exclusive breastfeeding until 6 months, and also a previous experience with tooth loss in the deciduous teeth in consequence of caries. So the previous experience with caries is one of the most important predictors for the future experience with caries also. As well, the mother scholar and also the conditions of the house and other inputs also. So after this, we made a risk calculator that has this shape, and we can see in that linkage. So let's see. This risk calculator that we developed for this research, we can here, for example, as in other studies that we did with João and Tiago and Nubia and Dante, we also made a calculation, a risk calculator, and we can make this calculator available, for example, for the primary health care centers, and the community health worker, for example, or the nurse or the doctor can go to the house of a pregnant woman and also go to the house when there is a child with 7 to 9 years old, and with only a little quantity of questions and very simple questions, we can predict with more than 70% of sensibility the risk of having caries and dental caries and tooth loss in the future. So let's make some example here. Making this. So the calculator will show us the risk of having dental caries and tooth loss in the age of 18 and 19 years old. Here we also can make the upload thinking in a manager, in a, uh, for example, the Ministry of Health, if they have some data in a, how can I say, spreadsheet in Excel.
Yeah.
So if they have this, they can make the upload of this file here, and also he can make the download of the results for all the municipality. And here we also put some, we can export the result and share with the mother and the child and whatever. And we can also make a plan with some orientations for the person, for the people. And also, this is another, let me see, how can I go back here? And also, we have here some informations of the project, what the project is, which our objective, which institutions are working with us, as for example, Duke University and OPAS with Thiago and João, and who we are, and our financing support. So let's get back. This is the orientations that we can make for people. And this is our team. So thank you very much.
All right, thank you, Erica. Very beautiful. The layout, the dashboard, all look very good. Amazing work.
Thank you,
Um,
João.
Wanna open for questions in the room or online, if you wanna type in questions or